Talking about today is National Doctors Day, a day that we set aside to recognize and celebrate all the ways in which doctors care for and heal patients. But all is not well. It is hard to become a doctor here in Connecticut. And joining us to talk about some of those issues plaguing the field of work, Dr. Ron Adelman from the Yale School of Medicine. Doctor, I'm sorry if I was not able to pronounce your name correctly, but we do certainly appreciate that you took the time to join us today on Doctors Day. Thank you for all that you have done. How are you today?
Thank you so much. I'm delighted to be with you today.
Yes, and glad to have you here. This is coming as a pivotal time right now, Doctors Day, as Connecticut physicians continue to try to provide some good science-based healing and find new treatments. But getting people into the field is harder than I'm guessing it should be. Can you talk about some of the challenges and some of the challenges that are specific to Connecticut?
So first of all, congratulations to all of our physicians for Doctors Day. And I appreciate all of the hard work that physicians in the state of Connecticut have done throughout the pandemic to enhance public health. So at this time, our medical schools are training best and brightest physicians of tomorrow. And our clinician scientists have done an amazing job discovering new pathways for debilitating diseases. But there are challenges in practice of medicine in this state. If we look, our physician workforce is aging, and only 15% of physicians are under age 40. There are challenges in practicing medicine in Connecticut that needs to be addressed.
Cost being one of them. I think at this point it's almost just a meme about student debt. And I imagine that is more of a concern for medical students, graduate students than almost any other field. But how much of a problem is that? And B, why isn't that a problem everywhere? Is that more of a problem in Connecticut than it is in other places in the country?
High cost of training is important, as you mentioned. Based on a study, the median debt of U.S. medical school graduates was about $200,000, and that doesn't take into account the undergraduate student loan. In our state, medical schools try to address that. And in other states, they have loan forgiveness program for people who practice in that state. We need to work on having a loan forgiveness program for our graduates so we can keep our graduates here in Connecticut.
Is Connecticut lacking a bit with regards, or at least in comparison to other states in the Northeast, in terms of retaining that talent?
Yes, there was a 2021 report from American Association of Medical Colleges, and Connecticut ranked 47th in the nation for retaining the physician that we train in our state. So we train some of the best and brightest. We have some of the best medical schools and best training programs, but when it comes to retaining them, we are lagging.
What are some of the other factors in that, at least in your opinion or empirically, that we can ascertain?
So there is a high risk of liability in our state. There is expensive cost of living. And also, as we mentioned, the lack of loan forgiveness is an issue. Also, there is increased administrative burden on physicians. There are prior authorization issues, high licensing costs, and high medical liability judgments. And also industry-specific taxes, such as taxes on ambulatory services. Those are some of the factors that actually affect the physician practice and the environment for practicing medicine in Connecticut.
Well, as you mentioned, loan forgiveness, Senate Bill 449 working its way through the state legislature may attempt to at least address that. But yeah, there's a lot of different concerns that need to be addressed. And Doctor, thank you for taking the time to join us just to bring some of them to light and starting a conversation that we have not had, at least on this show, and should probably talk about a lot more in the coming days and weeks. So we do appreciate the time that you've given us this morning. Thank you so much.